Exclusive details on yeast infection. Imagine a tiny organism that quietly lives inside your body, harmless most of the time, until the balance shifts. Suddenly, it multiplies out of control, causing itching, burning, and discomfort that many women find too embarrassing to talk about. That culprit is Candida, the fungus behind yeast infections. Though often dismissed as a simple infection, yeast infections are far from trivial. They affect millions worldwide. They recur frustratingly often, and they reveal a lot about the delicate balance between our immune system, hormones, and lifestyle. Understanding why yeast infections strike and why they keep coming back is not just about relief from irritation. It's about unlocking the secrets of your body's ecosystem and learning how to keep it in harmony. A yeast infection, medically termed vulvovaginal candidiasis, VVC, is caused predominantly by Candida albicans, a fungus that normally exists harmlessly within the vaginal flora. However, under favorable conditions, such as disrupted vaginal pH or immune imbalance, it proliferates excessively, leading to symptoms like itching, thick white discharge, burning sensation, redness, and discomfort during urination or intercourse. Symptoms. This condition can cause inflammation, intense itchiness, and a thick, white discharge from the vagina. People may experience pain areas in the vagina. Pain circumstances can occur during sexual intercourse or during urination. Groin, vaginal discharge, vaginal itching, vaginal inflammation or vulval inflammation. Also common, skin redness. Why yeast infections recur. Recurrent vulvovaginal candidiasis, RVVC, is defined as 4 or more symptomatic episodes within a year. Reasons include microbial imbalance. Overuse of antibiotics wipes out protective lactobacilli, giving Candida room to overgrow. Hormonal fluctuations, pregnancy, oral contraceptives, or high estrogen states increase glycogen in vaginal tissue, fueling fungal growth. Uncontrolled diabetes mellitus. Elevated blood sugar enhances fungal adhesion and colonization. Immune dysfunction, HIV, corticosteroid use, or immunosuppressive therapies weaken host defenses. Behavioral and lifestyle factors, tight synthetic clothing, poor genital hygiene practices, or frequent douching disrupt vaginal ecosystem. Incomplete treatment, inadequate or inconsistent antifungal therapy allows dormant spores to re-emerge. Preventive strategies. 1. Optimize vaginal environment. Avoid harsh soaps, scented products, or excessive douching. Wear cotton underwear. Avoid prolonged dampness. 2. Glycemic control. Maintain strict glucose regulation in diabetics. 3. Probiotics and diet. Regular intake of lactobacillus-rich foods, yogurt, kefir, may help restore microbial balance. 4. Rational antibiotic use, only when medically indicated, as broad-spectrum antibiotics heighten risk. 5. Hormonal regulation. Discuss alternative contraceptives if recurrent. Episodes are linked to estrogen-containing pills. 6. Sexual health, though not strictly sexually transmitted. Barrier protection may reduce irritation and reinfection. Management and control. A single dose of an oral antifungal drug or application of an antifungal cream for 1 to 3 days cures mild infections. Complicated infections require longer-term treatment. Acute episodes. Topical azole antifungals, clotrimazole, miconazole, or oral fluconazole, single dose for uncomplicated cases. Recurrent infections. Induction therapy, oral fluconazole every 72 hours for 3 doses. Maintenance, fluconazole once weekly for 6 months. Non-albican species require alternative therapy, boric acid capsules, nystatin suppositories. Adjunctive care, pain relief with sitz baths, maintaining vaginal moisture balance. Summary: yeast infection is a fungal overgrowth disorder influenced by host immunity, hormonal fluctuations, and lifestyle factors. Its recurrence is multifactorial, involving both biological predispositions and behavioral practices. Prevention hinges on vaginal ecosystem preservation, metabolic control, and judicious medication use, while management requires individualized antifungal, regimens with consideration for species resistance, conclusions and actionable plans. For individuals, maintain genital hygiene without overwashing. Choose breathable clothing and regulate blood sugar. Complete antifungal therapy even if symptoms resolve early. Monitor recurrence pattern and seek medical evaluation if greater than or equal to 4 episodes a year. For clinicians, public health. Promote antibiotic stewardship. Provide patient education on hygiene and risk factor modification. Screen for diabetes, HIV, and other underlying conditions in recurrent cases. Develop community level health campaigns emphasizing prevention over repeated treatment. In short, recurrent yeast infections reflect deeper host and lifestyle dynamics. Sustainable prevention comes from restoring balance, biological, hormonal, and behavioral, rather than repeatedly treating symptoms. A vaginal yeast infection looks like thick, white, and clumpy discharge, similar to cottage cheese, that can be odorless or have a mild yeasty smell. You may also see a red or irritated vulva, vaginal soreness, or burning. In other areas, like skin folds or the face, yeast infections can appear as red rashes, dry scaly patches, or white patches. In the vagina, discharge, thick, white, and clumpy, resembling cottage cheese. Appearance, the discharge is usually odorless and may leave small, white patches on toilet paper. Vulva, redness, irritation, burning, or soreness around the vulva. On the skin, face, skin folds, etc. Rash, a red rash with dry, scaly patches. Pimples or bumps. Small pimples or bumps may appear within the rash. Oozing, patches can ooze clear fluid, sometimes crusting over. Location, often found in skin folds, under the breasts, or around the mouth. Yeast infections may be common, but they don't have to control your life. By understanding the triggers, protecting your body's natural balance, and completing the right treatment, you can break the cycle of recurrence. Remember, prevention is always smarter than cure, and your health starts with the little choices you make every day. Stay informed, stay empowered, and let's keep the conversation about women's health open and stigma-free.
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.